Good afternoon. Thank you so much for joining for this month's meeting of the CTEL Telehealth Working Group. Today, we're going to talk about some updates from the White House regarding its national drug control strategy, as well as recent court actions affecting telehealth prescribing, a bill that was recently signed into law out of North Carolina with implications for telehealth, as well as some breaking news about leadership change at the FDA. So first, last week, the White House Office of Drug Control Policy released its 2026 National Drug Control Strategy. And I wanted to highlight how in one section of this, it talks about how, quote, as we learned during the COVID-19 pandemic, telehealth is an important tool to increase access to addiction treatment. Additionally, intensive outpatient programs provide access for those who do not require inpatient medical detoxification or 24-hour supervision. These programs are viable alternatives to inpatient and residential treatment and have shown to be as effective as inpatient treatment for most individuals seeking care. The Trump administration will work to continue telemedicine flexibilities for addiction care and treatment at all stages of addiction. Given that CTEL has been monitoring closely any developments regarding telehealth prescribing waivers coming out of the DEA, this does hopefully seem to be a good sign that the administration is interested in continuing these flexibilities in some form. Next, there's been some recent activity at the Supreme Court regarding telehealth prescribing of mifepristone. On Friday, May 1st, the Fifth Circuit Court moved to restrict nationwide access to mifepristone via direct-to-patient telehealth. But then shortly after, the Supreme Court intervened to block the decision from taking effect while it hears further arguments and puts out a more thorough decision. That was recently extended yesterday through at least Thursday. On the right is a letter that CTEL sent to the FDA commissioner regarding telehealth prescribing, highlighting how telehealth is held to the same standard of care as in-person care and how it is a viable and effective alternative for establishing patient-clinician relationships, conducting diagnosis, treatment, and management of disease, and prescribing medication as well. This comment letter is available on ctel.org/comment-letters. Out of North Carolina, House Bill 696 was signed into law on April 30th, which has a number of new policies for the state's Medicaid program. But specifically, I wanted to highlight some of its policies that will be taking effect regarding telehealth and autism treatments. First, the bill prohibits out-of-state enrollment for providers who would be providing autism-related treatment. It also limits the use of telehealth in diagnosis and treatment to a specific set of providers. And also, any eligible telehealth services can only compromise up to 50% of the services that can be provided. The bill does have a carve-out for parent, guardian, caregiver training to still be allowed via telehealth. We are tracking this to see whether or not these new mechanisms being introduced through the state's Medicaid program could potentially be expanded to other types of care or services, or if other states take similar actions to restrict out-of-state enrollment in telehealth for their Medicaid programs. Finally, I wanted to cover some breaking news out of the FDA. The Marty Makary, who was now formerly the commissioner of the FDA, has resigned effective today. This was just a few hours ago. This came after the White House greenlit his firing this past Friday. The push to fire Commissioner Makary came from primarily HHS leadership more than the White House, specifically pushed by Secretary RFK and other senior policy-making leaders in HHS. Makary had become increasingly embattled in recent months over his agency's handling of issues like flavored vapes, abortion medication, vaccine and medication reviews, and denials, as well as personal conflicts with him as well. Kyle Diamantis, a who is an official with the FDA in their food policy area, has taken over as the acting commissioner. Finally, in terms of upcoming events, on June 8th, CTEL will be holding a discussion on femtech and queer digital health, market opportunities, and growth strategies. And then later in June, we will be holding an in-person roundtable symposium in New York City focused on digital health markets and how policy shapes market activity in digital health. Registration for both of these events is available at ctel.org. Thank you so much for joining us, and I hope you have a great rest of your day.